हाय गाइस, स्वागत है आपका मेरे YouTube चैनल पर। And today's video is yet another video in the series of videos which we have made on the topic of gynecomastia. Many people who come for consultation about the gynecomastia ask this important question during the course of consultation, that what are the chances of getting a cancer in gynecomastia. For this reason, I decided to make a video on this topic in order to understand this topic well and to allay the fear of cancer in patients who are suffering from gynecomastia. We will discuss about little bit about the causes of gynecomastia, its hormonal reason, and how it is not possible to have cancer in gynecomastia, and what are the signs and symptoms of male breast cancer, which is another important entity one should be aware of. So without much wait, we will start the video. My name is Dr. Lokesh Kumar and I am a senior consultant plastic surgeon in Delhi and NCR. अगर आपने मेरा YouTube चैनल अभी तक सब्सक्राइब नहीं किया है तो अब आप इसको स्क्रीन पर दिए गए बटन के द्वारा सब्सक्राइब कर सकते हैं, जिससे इस टॉपिक से रिलेटेड फ्यूचर वीडियोस एंड जानकारियां आप तक पहुंच सके और नोटिफिकेशन आपको भेजे जा सके. सो कमिंग टू द टॉपिक ऑफ gynecomastia, whether it is possible to have cancer in gynecomastia or not, I'll discuss in detail. As I discussed in my previous video, the most important, most frequent cause of appearance of gynecomastia is hormonal, where the hormonal imbalance leads to the increased size in the breast. So many people ask, is it important to get the hormonal testing done in gynecomastia cases? And my answer to this question is that in most cases, in about 90% cases, it is not necessary to check and to get the hormone profile of the body. The reason being that in 90% of the cases, the gynecomastia is idiopathic gynecomastia, where the cause is not known, and as I described and discussed previously, that it is the female hormone which was in excess before the age of 12, and somehow it affects the breast gland in some people. And by the time you attain about 14 to 15 or 16 years of age, it has no significance. The hormone has gone down to normal, but the breast does not get reduced in size automatically without the surgical help. So if you see, because the cause is idiopathic, it is not necessary to do the hormone profile in all the cases. However, in some of the cases, it is important to do the hormone profile, and we get and seek consultation of our endocrine colleagues, and the cases which we send to for endocrine consultation are the ones which have other signs of hormone imbalance in the body, like absence of beard, absence of chest hairs, absence of secondary pubic hairs, secondary characters of sex characters like pubic hairs, and feminization of the body, like a female-like body, where the fatty deposition in the body is like a female. So all these cases, they warrant a consultation with endocrinologist. Now this happens only about 5 to 10% cases, not more than that. In 90% cases, it is entirely unnecessary. The second important question which comes to mind is about the cancer. Now, male breast cancer is a very risky and dangerous entity. If a male suffers from the breast cancer, it can be fatal. So it is important to differentiate the gynecomastia from the cancer. The cancer most of the time in male breast happens only in one breast. So a case of unilateral gynecomastia, we have to look at that with suspicion that if it is cancer or not. And a simple test like fine needle aspiration biopsy can detect if there are cancer cells in that unilateral gynecomastia or not. Bilateral gynecomastia is almost never a cancer risk in the body. It is not necessary to get even the mammogram in most of the cases, but if there is a high suspicion of having cancer in a unilateral gynecomastia, and many a times we clinician with clinical examination can tell with the hardness of the tissues inside the breast whether there is a suspicion of cancer or not. And if we suspect, we send the patient for this simple test called FNAC, fine needle aspiration cytology, and the mammogram, which easily tell us that patient is suffering from cancer or not. So rest assured, in majority of the cases, there is no risk of cancer either because of the gynecomastia or otherwise. But in a unilateral gynecomastia case, we have to have a high degree of suspicion, and if on clinical examination the gland is very hard on palpation or feel, then we do the further testing. I hope जानकारी जो हमने इस वीडियो में आपको दी आपके लिए काफ़ी यूज़फुल होगी, एंड आपका जो डर है कैंसर का डर को रिमूव करने में काफ़ी हद तक मददगार ये वीडियो साबित होगा. I thank you for watching this important video on gynecomastia. इस वीडियो को लाइक और शेयर करना ना भूलें और इस वीडियो को ज़्यादा से ज़्यादा फ्रेंड्स के साथ शेयर करें जिससे ये जानकारी उन तक भी पहुंच सके. Again, thanks for watching, and we will bring more such educative video on this important topic because this gynecomastia is a very common condition amongst youngsters these days. Thanks for watching.